Okay.
Mm-hmm.
You are a pro. Here on the forehead. Blackhead here. Get anything out of that one? Good. So there's a few here. Maybe I don't even need to. Yep, don't even need to put a little nick in the skin. Well, you gotta do what you gotta do. I'm gonna push on you again, pressure.
And then
You got a gold mine here, though. Let me just tell you, I just did one little section and a bunch of them came out.
Guys,
so they're just waiting.
Guys at work were like, dude, you gotta go to the skin doctor. What's those things on your head? I'm like, I know, I don't know what they are.
You know, they're gonna be so jealous now. You're gonna be prettier than them.
But I scrub, you know, like
it's under the skin.
I tried scrubbing at work, you know,
you have to use these special instruments like we have here that we squeeze them out. We'll show you the video afterwards. You'll be pretty. I think you'll be pretty cool. It'll be pretty cool for you to see it. I'm gonna try to get the black ones because I think those are the ones that you see the most. Put up here now. Pressure on you. See how they're all, and like mainly in the creases of his forehead. Moving right along here. You know what, I'll have to say yours are pretty satisfying to do. And they are, because I'll see your forehead lines, your forehead lines aren't going to look so deep anymore. They're going to be all clean.
Right.
Nice and pretty that is now. Just kind of run them, even if I can't see anything, if I run them along your forehead line, I think some of them will pop up. There we go. Nice and clean. Let's go a little on his forehead. Look at the ones along his forehead line here. Let's just clean those up. Some of them are a little tough. I'm going to come back with them with a little bit of a nick on in the skin to get them exposed a little bit. Turn your head this way a little bit. Thank you. Better already. There's two here that I'm on a mission. I must get them.
And now, how often do they come back, Doc?
I just think sun exposure.
Sun exposure.
Yeah, I mean,
so
you know, I think you're gonna get a pretty big, pretty long reprieve here because I'm sure a lot of these have been here for quite a while. So you know, you might start getting little ones, but they'll take a while to get bigger again.
Okay.
And if you try to use a little Retin-A, like we said, I think we can probably help to prevent a lot of these. There's just a bunch of little ones here. Let me see if I can work on them. Get the black ones so that they're not so visible. Give me a little sucker. I think I need to get. God, these are pretty. Actually, I think we're cleaning you all up. Let's get a couple of these up here. Remember when I said it was going to take more than one visit? I think we're going to get you pretty. Good one. Oh, that one came right out. That was steamed out. Thanks to Jackie, our esthetician. She's the one that got that one out. Had you ever had a facial before? Oh, that was your first facial, huh? We're gonna have to keep doing that. You're not gonna be able to come back from that way of life. Getting spoiled. I think your wife's a little jealous. You're getting this star treatment, huh? She is. Whenever she comes in too, she's always saying, "Can I get a blackhead pop too?" Wow, these just keep giving. But I think we did a good job here today. Really good. All right. Wait, I see one more on the tip of your nose here. More on the top. I think we really addressed the top of your nose here. Push and clean it up a little bit. Okay. I don't know if your wife's going to recognize you when you get home. You're going to be a new man. Pressure on these. Wow, when a lot of these just want to come out. They're like ready. You okay, huh?
Yep.
Wow, these are just waiting. They're wonderful. They're good ones. You probably every now and then kind of squeeze your nose and out pops a bunch of them, huh?
Yeah, I do every once in a while.
Yeah. You don't let your wife do it? She's not interested? No.
She will every once in a while, but she's...
Is it hard for her to get around, kind of? Or is she okay?
She just...
She's not that interested in it.
It's too good of an opportunity to get even.
That's a good answer. Good answer. You okay, huh?
Mm-hmm.
Okay. Get out a bunch of these, and that's going to make them nice and clean here. We're going to treat some of these up here on your forehead, these blackheads here, okay? So I'm just going to put a little pressure on you. Let me just try a couple of them here first and see how well they express without me squeezing, without me doing anything other than just pushing on them. You okay?
Yeah.
Okay, there's some more coming out. There's one. Do you use Retin-A already? Probably, huh? He's probably got you on something.
Yes.
Good. You okay? Just tell me if you need a break. I have another Comedone extractor here that's got a pinched end, as you can see here, because this actually helps to get these smaller ones. Just tell me if you need a break. You've got some good ones. All right. He's pretty tough, huh? Are you? Yeah?
Yeah.
Yeah, I see that. I know this does not feel great. Trying to take it easy and just slowly increase the pressure on you. As I try to get some of these out. You're doing great. Halfway through with your forehead. A little white one there too. This is gonna help to start you on a cleaner slate, I think, with your acne. You're probably on some antibiotics maybe, and maybe on antibiotics, but mainly topical.